how important it's been to him recently when they've been redesigning a service to integrate some digital telecare or digital solutions in there. And then we get to hear from Sharon Hanna, who's recently moved out of the HSCP and is now in East Renfrewshire Council, and she's Business Readiness Manager for Analogue to Digital Telecare. And she'll be speaking really about the importance that they're finding of partnership working as they prepare to transition. And last but by no means least, we're delighted Stephen Rankin is joining us. So he's head of the contact centre operations at Field Housing and Care. So he'll be telling us a little bit more really about the housing transition side of the work that he's been involved with Field. Also some of the things that they're considering about digital and what it'll mean to them, and of course the steps that they're taking in their alarm receiving centre. So I'm not going to whittle on much longer. If you've got any doubt, go up to the speech bubble, find the chat now, and please put in your questions. If there's loads and loads of them, we're going to send them out afterwards if there's any that we haven't managed to answer. This session is being recorded and the session will be available after our event. Okay, so I'd like to just hand over to you now, David. So welcome to David Brown, Business Relationship Manager at the Digital Telecare Digital Office for Scottish Local Government.
Thanks, Geraldine, and hello everyone. Thanks for having me along today. Next slide, please. Yep, so as Geraldine says, my name's David Brown. I'm Business Relationship Manager with the Digital Telecare team within the Digital Office. I'm responsible for leading the programme and also managing the team that deliver the activity within the programme. Prior to moving into this role, I was a senior manager with the Edinburgh Health and Social Care Partnership. I was responsible for a range of frontline services, one of which was telecare, along with housing. And I was also the partnerships lead officer for digital telecare for a few years prior to moving into this role. So I've been involved in this programme with a couple of different hats on for a few years now. Next slide, please. So just a bit of scene setting initially. I'm going to try really hard to stick to 10 minutes for this presentation, or I'll get around off Geraldine again. So just a bit of light touch scene setting. So the Digital Office works with 32 Scottish local authorities and supports those organisations to deliver digital transformation, which is aimed to improve areas around data, technology, digital. And it's to support these organisations to deliver top-class digital services for citizens. As well as working with 32 local authorities, the Digital Office collaborates with the wider public sector with a whole range of kind of stakeholders and partners, some of which are listed on the screen, including Scottish Government, SOCATIM, Scotland Excel and others. And as I said, the main purpose of the Digital Office is around developing wider public sector strategic direction around digital improvement and digital innovation. Next slide, please. Yeah, there you go. There might be a wee bit of delay sometimes with these slides, so I might be just not seeing them as quickly as they're clicked. Just a little bit of scene setting again around telecare. So the Scottish Government definition of telecare, which I think is quite interesting from my perspective, is a technology provision, technology package for a user that goes above and beyond what's known as a community alarm package. So lots of people on the call will recognise that as potentially a kind of box and button type telecare service. So that includes, there's a list on the screen there, some of the sensors that could be included in that provision. There's a much larger list of technology surrounding telecare at the moment. I think for me though, I would say operationally in Scotland, we're seeing telecare being used as a bit of an umbrella term. So for me, it's kind of cross-cutting and it cuts right across all sectors in Scotland. And I think it can be used to describe any service that supports someone to stay independently at home as part of kind of a provision of a service, which includes technology within that. Next slide, please. Yeah, a little bit more about the sector in Scotland. So based on some of the findings from the Deloitte's feasibility study, Around about 180,000 people in Scotland currently receive some kind of telecare service. And that's, as I said earlier, that's kind of cross-cutting right across all sectors. Service providers spend around about £39 million per year to deliver these services, and those go on to generate benefits to the wider Scottish public sector worth around £99 million per year. Those benefits are mainly felt in social care and NHS, and they're largely non-cash releasing benefits, so they relate mainly to prevention of admissions to care homes and hospitals. Next slide, please. So by 2025, the existing analogue telephony network will be switched off and transitioned over to a digital solution. So that's all of the kind of copper lines and the aging infrastructure that's been in place for decades in the UK. Next slide, please. So this announcement was made back in 2017 by all of the main telephony providers in the UK. Maybe just important to know that that work is underway now. This migration is actively happening. So there's lots of examples in Scotland recently where service providers or service users have been impacted by this change. It's a cross-cutting change, so it affects telecare service providers across all sectors. Back in 2017, following the announcement that this work would be completed by 2025, the Scottish Government Tech Programme commissioned the Digital Office to go away and mobilise a programme of work to try and support service providers through the transition and through all the kind of key milestones and stages. Next slide, please. So at that time, the Digital Telecare team were established within the wider Digital Office. They were established to support the strategic direction of the transition to support service providers through this change. It's a significant change for service providers in Scotland. It's moving from analogue to digital technology. It's moving from a really kind of stable set of technology within the sector and telecare in Scotland that hasn't really changed significantly over a couple of decades into a much more kind of specialist, innovative area. The programme aims to kind of achieve its goals through thought leadership, through accessing things like thought leadership, bringing operational telecare management experience and knowledge to the programme. Digital security is a kind of key factor of this transition. So we have access to the Digital Office Chief Information Security Officer, Andy Grayland, who's a cybersecurity expert. We take a programme and project management approach, and we take a once for Scotland approach, where we really look to kind of harness and leverage any of the learning that service providers deliver back in the programme, and we look to kind of to pull that together and share across the network, just to try and kind of reduce duplication, save people time and effort, and keep things as simple as we can. Next slide, please. So a little bit more about the drivers for change, and I think John will cover this off in his session after myself. But the deadline for this transition to a full all IP solution is 2025. I mentioned earlier that work's underway and has been underway for some time and is having a direct impact on services and users. Probably another kind of key milestone for me around this is the nationwide stop sell, which will be implemented by September 2023. So I think operationally, for me, that's quite a scary milestone. That means that there will be no analogue telephony provision after that date. So for kind of traditional telecare users or people who rely on technology care provision that uses analogue signalling, their telephony might be upgraded to digital without them maybe knowing in some cases. So it could be part of a kind of wider service offering around things like faster broadband or a better TV package. And actually the outcome of that could mean that the analogue equipment in the property no longer works. So the purpose and the focus of the programme is around supporting all service providers in Scotland to move through this challenge, to do it kind of safely and securely and as quickly as we can. But actually one of the most exciting things about the programme for me is also about how you leverage the digital solution once you've deployed it. So how do you kind of improve the service offering for your service users? Next slide. So yeah, just a little about the kind of evolution of telecare services. So reasons for implementing digital telecare fall into three broad categories. The first and foremost, the first category is around keeping the lights on and making sure that you can continue to deliver services to the 180,000 or so people I mentioned earlier. These are kind of critical services that any kind of disruption to the sector could have fairly significant impact on users and on the wider system. Digital telecare also allows services the opportunities to meet increased demand and complexity that we're all faced with in Scotland at the moment. And as I mentioned, it allows services the opportunity to kind of improve the offering for users. And some of the benefits are a much greater degree in flexibility in how alarm calls are routed and shared, much greater resilience and reliability of your system and of your service. And the digital transition unlocks lots of innovation opportunities for service providers. Next slide, please. So in terms of our own programme, so we've been working with a small group initially of early adopters. This group have been working really hard to get through all the kind of key milestones of digital transition. It's a significant shift, as I mentioned earlier, to move from an analogue telecare sector in Scotland that's probably traditionally sat off to the side of health and social care partnerships or other services and maybe had kind of less attention than it should have had. So there's been quite a bit of work to support service providers kind of mobilise these programmes, to build relationships with key stakeholders, to get kind of senior level buy-in and sponsorship, and to kind of move through lots of key milestones that are fairly complex and haven't been an issue for analogue services in the past. So things like cybersecurity that I mentioned earlier, things like penetration testing, data privacy impact assessments, all of these areas are completely new for most telecare service providers. Up till now, a number of service providers have succeeded in deploying a live digital alarm receiving centre and are at various stages of testing. Late last year, we went live with our first connections with citizens. So we have some digitally connected citizens into alarm receiving centres. And the plan for this year is to increase the number of service providers that have transitioned over and increase, kind of scale up to the number of users that have that digital connection. As I mentioned earlier, there's been a huge amount of learning and kind of key information that's came back from not just the kind of early adopters that were part of the programme, but the additional kind of 20 or so funded providers we onboarded last year to the programme. And all of that kind of key learning and information has been captured and distilled down and folded into what we've called our digital telecare playbook. Next slide, please. So the challenge for us as a programme was, how do we support a whole range of different service providers with a whole range of operating models and challenges, not just to transition over safely and securely before the deadline, before the switch off in 2025, but as I've mentioned earlier, to do so in a way that lets service providers exploit the capabilities of their updated solutions. So to kind of harness and leverage the opportunities for innovation and an improved offering for citizens. Next slide. So yeah, I mentioned the creation of our digital telecare playbook. So this has been a co-designed resource. It's been co-produced with service providers who are transitioning. It's a range of information, guidance, templates, advice, kind of templates sometimes are being kind of pre-populated where we can, just to make, as I've mentioned earlier, to make things as kind of lean and straightforward as we can. There's a real focus in the programme around saving you all time and effort because we know how busy the sector is. All of these resources have been arranged into themed pathways, which I'll talk about in the next slide. And these are there for people to access. The playbook's there for people to sign up and register with and access and move through all of the kind of key learning, key milestones of the digital transition. And this is being co-created to draw on experiential knowledge of the providers who are transitioning, technical expertise, not just from within the programme, but from other organisations and other groups, and some international research as well, which has been a part of the programme over the last kind of 12 months or so. Next slide, please. Next slide, please. So yeah, so we have a number of pathways live. We launched the playbook in October 2019 with our management pathway. We went on through 2020 to launch the technical and security pathway, procurement pathway, and stakeholder engagement pathway. We have plans early this year to launch our workforce pathway and also a citizen pathway, which the purpose of the citizen pathway is to make sure that citizens are included in this change. It's kind of vital that their voice is heard, I would say, and how services are developed and designed. And all of the pathways in the playbook at the moment are broken down to a number of key kind of steps and milestones broken down over 3 phases, so discovery, planning, and implementation. Next slide, please. Yeah, just a bit about kind of usage. I mean, the feedback we've had from service providers has been really powerful around the playbook, and I know myself, having previously been responsible for transitioning a service, it's a significant shift. There's an awful lot of new things to learn for service providers, and it's an already kind of busy sector. So we've been really pleased with the response we've had so far. Since we launched it, 864 documents have been downloaded, and you can see on the screen there the kind of top 5 downloads. I just wanted to give you a kind of practical example around the last one there, data protection impact assessment. So when I was leading this piece of work for the partnership in Edinburgh, it took me literally 12 months from kind of first draft of that document through to sign off by chief officer to get that over the line. I spoke to a service provider recently who had gone into the playbook and downloaded all of the resources in that section about DPIA, taken it along to a meeting with our information governance team and asked the question, what else do I need to do here? And the answer was nothing. Everything you've got here is great. We're good to go. So I think that for me is just kind of one example that we use that kind of demonstrates that what we hope this resource will do for you all, which is really kind of simplify and shorten your transition journey. And given there's so much risk around not transitioning safely and securely to your users and to service providers, that's it. That's a kind of main driver and the main focus of every resource that goes into the playbook. Next slide, please. Yeah, just a little bit about our plans for the coming year. So we'll continue to iterate and develop the playbook. It's a live resource, so documents in the playbook are continually being kind of updated and developed based on the additional learning that's coming back from the programme. We recently launched a remote working test of change, and you will all be familiar with the need for remote working over the last 12 months. So we're just really keen to kind of build some learning around how telecare service providers can deploy that for staff. We run monthly technical advisory group meetings for service providers who are transitioning, and that's where you get into the kind of more granular technical discussion. We're just about to launch our first Scottish Telecare Service Provider Forum, which is how we're kind of hoping to engage with the wider sector. But I'm going to let Craig talk a wee bit more about that in his presentation. We're really well linked in with people like Ofcom and telecare service providers, and we'll continue to kind of update the network as and when we get updated timescales around the transition, the switch off, and that type of thing. I mentioned earlier we are involved in a twinning project with some other regions in Europe. From a programme perspective, that's been really, really valuable for us to kind of understand more about what's happening out with the UK. And so we're twinned with ADGAR in Norway and Andalusia in Spain. So that's been really helpful for us in terms of our own thinking. And last but not least, I've mentioned a few times around one of the most exciting things around this programme for me is not just allowing you to keep delivering these critical services. It's actually around what that unlocks when you do. So we've just launched a Bring Your Own Device project with Tech and Housing and Scottish Government Tech colleagues to look at the introduction of consumer technologies into this area in this sector and see how these can kind of link with alarm receiving centres and the kind of wider telecare system. Yep, and that's myself, I think. Next slide. Thank you.
Thanks very much, David. Roughly kept to time, but you covered an awful lot there. So that was really great. What we'll do is we'll have John's presentation and then Craig's, and then we'll come back if there's any questions in there, David, if that's okay. So Karen,
Yeah,
if
no
we're
problem.
okay. Yeah, thanks, David. So Karen, if we're okay, then we'll maybe run John's presentation now.
Hi there, my name is John Livermore. I'm the All IP Industry Engagement Manager for Openreach, and I'm really grateful for your time today. I'm sorry I couldn't be with you in person at your event. I wish you all the very best. I just wonder if I can take maybe 10 minutes of your time to explain what is considered to be the biggest programme ever to affect the UK's telephony industry, probably in a lifetime. And that is the move from analogue to digital, also known as the All IP programme. I'll just share with you some slides and explain how it's going to affect each and every one of us. So let's start by doing that. So formal introductions. My name is John Livermore. As I said, I work with my colleague Phil Laws, and we are Openreach. Our role is to reach out to industry, and that means not our usual customers, which are communications providers, but actually to everyone really that will have a hearing ear when it comes to this transformation, because it's going to be very huge and very complex, and we need to be ready for it. In terms of understanding this in a bit more detail, let's start off by saying who Openreach are. What we are not is BT. We are Openreach Limited, and in fact we sell to communications providers such as BT, but you'll notice also Sky, TalkTalk, Gamma, Daisy, and many other communications providers. In fact, you'll be surprised to know there's some 650 communications providers in the UK. So that's our positioning. We sell to communications providers, but we're reaching out to you today because we're very concerned that you have the information you need and understand, so that when your communication provider comes to you about this transformation, you are ready to go. Why is it happening? Well, effectively, the current network we have has been in place for a very long time, and in fact will continue to be so. But the point is this: in the 1980s, there were digital exchanges brought in, and they are now getting quite old. They're 35 to 40 years old. The equipment is hard to source, and the people that put them in the first place have now perhaps retired. It is for this reason that we need to change out our network the way it works, and this is a program that is going through until December 2025. Ofcom are on board with it and have given us their guidance in terms of making this happen. And so therefore, over the next 5 years, although the programme has been going since 2018, we're really going to see a rapid change in terms of what's happening. Let me just talk about some key dates with you. The first one there is this 2025 date. So at the end of 2025, or when we wake up on the 1st of January 2026, we will no longer have access to a portfolio that is called WLR, or wholesale line rental. Now, don't get too worried about what these things mean. It's just basically a product name for a suite of products which are all copper. That's copper all the way from the telephone exchange to the street cabinet and into the premises. They are going to be replaced, and are already being replaced, by fibre to the premises, fibre that goes all the way through from end to end, and fibre to the cabinet, which already covers some 95% of the UK, which is part copper and part fibre, and more of that later. It's worthwhile calling out, though, that if you have a standard line, either you call it PSTN maybe, or analogue line, or ISDN, all of those will be affected by this change. So at the end of 2025, you'll no longer have access to lines that are copper end-to-end. Instead, what's going to happen in the next 5 years is every one of the communications providers I mentioned earlier are going to have to migrate all of us, that's you and me at home, in our offices, and also the devices that we use in our industry, whether that's telecare devices, alarms, chip and pin machines, critical national infrastructure, telemetry, things like water, gas, electric, and telemetry they use for their networks. All of that is going to have to be changed to something that works with IP, or the Internet Protocol. Think of it in this way: everything today that's plugged into your wall socket is going to have to work in future through a router of some description. So the next 5 years, we will all be contacted by our communication providers when they're ready, and we will be told on a certain date maybe that we are going to move to this all IP, and they will tell us what we have to do in the premises so that we are ready for that. That's what's going to happen, but of course you have to remember that the more lines that we continue to sell, which are all copper, which are this WLR, PSTN type lines, the bigger the problem we're making for ourselves, because we're going to have to migrate all those lines over anyway. So that means that from 2023, in September 2023 to be specific, Openreach are implementing what we're calling a stop sell nationally. That means that a communications provider who comes to Openreach from that date will be told that they can no longer take those products, those older products from us. They will have to move their customer onto something that is at least partly fibre. Now, there is, of course, this mass rollout plan of fibre, and at the moment we're about 4.5 million premises have access to all fibre. Fibre is a very good medium because, unlike metal, it is very good at, it's very good at, for example, keeping out the weather, compared with joint boxes, which can fill up with water and things like that, and can affect the copper and therefore affect transmission and so on. It also allows much bigger bandwidth. So that means that the Internet of Things is possible. The telemetry things we've been talking about for years, the biometrics, all those things become possible because of sending large packets of data down fibre lines, which is much quicker. But of course, it does mean that we have to stop selling the older products. And that's what's going to happen in September 2023. In fact, because at the moment we are rolling out fibre to the premises and have hit that number about 4.5 million, and we hope to get to around about 20 million by the mid-2020s. This means that we are going to implement an earlier stop sell regime for exchanges in certain areas. Now, those areas are being picked by exchange area, and the rollout they have of fibre to the premises, so all fibre lines or full fibre lines, and the ratio is 75%. So where we believe we're going to have at least 75% of premises covered by fibre to the premises, they are going to hit an earlier stop sell date. And we have to give 12 months notice to the industry. And already we have given notice of some 220 exchanges where we will be stopping selling those older products earlier because those areas already have fibre to the cabinet, 95% coverage we talked about of the UK, and also they will have at least 75% coverage of fibre to the premises. Our first stop sell happened last December in Salisbury in Wiltshire, and that's because it was a test site for us, which has over 90% fibre to the premises. But in June this year, the first batch of 117 exchanges, which we notified the industry of back in June last year, will hit their stop sell date. So that will be another bumper stop sell exchanges, which means that more customers will not get access to those older products because fibre to the premises is there. Let's just spend a moment now looking at the situation in terms of the street. At the moment today, very simply, we have this green box, which is what we talked about, WLR, wholesale line rental, PSTN, standard copper lines at our end to end. There's about 5,500 of those exchanges. And what Openreach sells to communications providers is a package that includes that all copper line, but also it includes a voice product. We have dial tone. We get a voltage down the line, which means if there's a power cut, our line still works because the power is not coming from our power company, but from the local telephone exchange. That's what we mean by WLR or PSTN. And you can see there in our diagram, it's all copper end to end on this green line. And we put a big question mark there at the end saying, we just don't know what's the end of it. You will know, but we won't. You notice a purple line at the bottom of this slide, that's fibre to the premises. That's pretty straightforward. It is what it is. It doesn't go through a street cabinet. It is fibre all the way through with all the benefits of that. But for the majority of us, we may not have access to fibre to the premises by the end of 2025. So our migration path will be on to fibre to the cabinet or FTTC. Now you'll see on the diagram that for FTTC, there is still the copper that runs from our premises to the street cabinet. And then effectively today it has maybe what you call a V shape. It's got two lines coming out, the traditional copper line, which was there anyway, and now it's had the addition of a fibre line there, which takes the internet traffic. But ultimately, if we pick up our phone, our calls are probably still going over the copper path, whereas our data is going over the fibre path there. On the day that your communication provider migrates you to all IP or digital, this is what happens. You will lose access to that copper path, and all you will have left effectively is the copper from the cabinet to your premises and that fibre, which we talked about earlier, which takes you back to the exchange. Now you notice that fibre to the cabinet has also been renamed again. Don't worry, that's purely a product naming for Openreach. It's now called Sogia, or in some cases SOG Fast, which is a faster service because it has a little bit of data added to it and a box of tricks effectively at the cabinet. But SOGEA is fibre to the cabinet, but without that copper path. So that means that on the day of your migration, you will lose access to that copper path back to the exchange. Everything that you are using for the premises must go over that fibre. So let's move inside the premises and understand that better. So today, on a very simple diagram here, we've chosen the premises, but this could apply to a home, to a business, to a lift line. It really doesn't matter. It's all the same thing. You have a master socket, and from that master socket, you may have extensions and a number of pieces of equipment that may be used at that premises. You may also have today broadband, in which case you may have a router. On the day of your migration by your communication provider, you'll see there is a change. And in essence, the only thing that comes through your wall socket now is broadband. There is no 50 volts that keeps things going when you have a power cut locally. You don't have dial tone coming from it. All you're going to get out of the wall socket is going to be broadband. That means, in essence, everything in the premises that is plugged in today to a wall socket, to an extension, has got to work through the router. That is the only way of communicating, which of course raises a very important question. What are you going to do? How are you going to communicate those devices through your router? Well, if they're Wi-Fi, if they're IP ready, great, should work fine. If they are DECT, some cases, communications providers are providing a DECT chip within their routers so you can communicate with that. But ultimately, you need to ask yourself this question. My communications provider, are they going to provide me with a router that is going to have an analog port in the back? Some will, and some you haven't said what they were going to do. If you do get an analog port provided in the back of your new router by your communications provider, that may solve your problems in terms of plugging things now into the back of the router. But again, a word of caution, even if you get that type of router from your communications provider with an analog port in the back, sometimes known as an ATA port, then you also need to make sure that that communications provider is also providing you with their voice over IP service to make that port work. So ask them that question. Does that also come with that service? And if it does, you may be able to plug things into the back and they may work. But a word of caution again, do make sure you speak to your service providers who sold you or rent you that hardware and say, when this happens to me, is the device you sold me, is a device that I rent from you, is that going to work if I plug it into the back of a router? Because they should really be testing and making sure that equipment is going to work. To the end, OpenReach are going to open a test lab, hopefully around about June, July this year, and we're going to be inviting communication providers to set their equipment up and inviting anybody then who wants to come in to test their equipment in that environment to do so and then come back to their customers and tell them what will work and what won't. Some of these test labs have been around in communication providers for a few years now, and a lot of testing has been done already. But again, a word to the wise, ask your provider, have they tested? Is the equipment you've got today going to work tomorrow if it is provided to plug in the back of a router? And ask your CP, your communications provider, are they going to give you that type of router if you ask for one? The only other thing we need to call out on this slide is we've talked quite a lot so far about SOGEA, which is fibre to the cabinet, but without the copper path back to the exchange. You may also, of course, have fibre to the premises. That may be your first option, particularly in those full fibre exchanges on that stop sell list we talked about. But in that case, you will not have a master socket. You'll be converted to something called an optical network termination point, or ONT, known in the trade. The thing to remember about that is that ONT needs to have power all the time. So if you wanted to continue to work in a power cut, you will need to think about independently providing power to that ONT. And again, with the router, because you're no longer getting power from the telephone exchange, you need to think carefully about whether you're going to get some kind of battery backup unit to keep the router going. So again, in the case of a power cut, you need to keep the router going, and for FTTP, the ONT as well. Finally, again, I'd like to thank you for your time. Really, appreciate that. The message really, the call out to you is, again, think about what's plugged into the master socket. Remember that on conversion by your communications provider in the next 5 years, they will only be giving you broadband out of that wall socket. And certainly from the ONT we talked about in that case, think about local powering, battery backup, things like that. Have a plan, do a risk assessment, impact assessment, make sure that you are ready. Please keep tabs on us. You'll notice a couple of links here. One of them is to an industry web page specifically designed not for communications providers, but for you and me to be able to check on the progress. And you can get the sliders from today there. You can also get the frequently asked questions, and you can also get the list of stop sell exchanges from there as well. And do register for our quarterly newsletter, which will have more on a quarterly basis. Again, thank you for your time today. Have a great event. All the best.
Okay, so that was all rather technical. I hope we haven't lost too many of you during that, but we really wanted John to be involved in this because it does have such a range of implications, not just for your telecare, and we were very aware that this is telecare analog to digital. And so we wanted you to be able to visually be able to see what's happening, because it will have huge implications for your own homes, for your family's homes, for your customers, for your tenants, for your offices. So it's just to make sure that it's fully up there on the agenda, especially if you're planning or actually in the process of doing new builds. You know, that push to get fibre to the property. I know somebody who's just recently moved into a new house and they've had to join forces to get fibre to the property because it just wasn't there, and so they're future proofing, but also that idea of having increased sockets and stuff like that. So anyhow, I'm going to pass over to Craig now, and like I said, Craig is our housing digital transition manager. So Craig, if you would like to, if I can invite you to turn on your camera and your mic, and I'll hand over to you.
Perfect, thank you very much. Good afternoon, everybody. I just want to start off by thanking John for doing that presentation. I know he was unable to come along to the webinar itself, but I think it was quite helpful just to hear, as much as it was technical, and I know myself from being a kind of provider and being involved in this transition previously in another organisation, it's quite helpful just to get an understanding of the kind of OpenReach view of the All IP programme. So thanks, John. To kick off with a short introduction, as Geraldine has said, my name's Craig, and I'm now part of the digital office to work with housing organisations across the country with the technical transition, but also the transition for the individuals living in your homes, and look at how we can harness the benefits to your organisation, but also to the individuals as well. My background is in technology-enabled care and supported housing, and has been for the last 12 years. And as I say, I have previously been involved in this transition within Edinburgh's Health and Social Care Partnership. I've seen kind of technology-enabled care and supported housing change significantly over the last 12 years, whether that be through kind of leap changes or incremental changes to how we do things. And I think this is just another catalyst for yet another change, which I think will be great. The housing programme is new. It's a new part of the kind of broader digital telecare programme. So I've not got a significant amount to present to you today, because what I'm hoping is that after this webinar, I'll be able to engage with more organisations and get a clearer idea on what people actually need. So what are the drivers? We know that there's 180,000 telecare links across Scotland, of which 45,000 of them are either from a housing provider or a private provider. Geraldine mentioned earlier around data. I think over the next 2 years, as we start to work with more organisations, we'll get a better idea of exactly what that data looks like. I think we all need to pay attention to what we've learned from COVID-19 over the last 12 months. I think we've all either been directly involved or observed significant changes in the way we work, not just within our own organisations, but across various organisations to kind of improve outcomes for people. We've seen kind of previous restraints around partnership working being kind of cut down, and a real focus on how we become preventative and proactive to improve outcomes. So I think we need to hold on to that. The fourth thing is around digital inclusion, and I'll come into that a bit more detail on my next slide. The next 4 points below Sorry, could you go to the next slide, please? Thank you. Sorry. The 4 points at the bottom of that slide really echo what David and John have already said. You know, the analog infrastructure change has a hard stop by 2025. But it has started now, and we know that there's a phased migration starting right now. So the stop sale of analog infrastructure is coming in 2023, so you'll no longer be able to purchase that infrastructure. And for new builds that are being built right now, this has a direct impact. And the Digital Office have been working in partnership with various organisations since 2018 to assist with that transition. Just to go into a little bit more detail about digital inclusion, a lot of you will have already seen it. Next slide, please. So I just wanted to draw your attention to the Housing to 2040 strategy, and just 3 extracts from that, which really call out digital as being a key enabler of technology-enabled care. And it's likely if you're on this call, you know, you're currently looking after tenancies where there's telecare in a kind of grouped living setting that provides an element of care and support. And it is absolutely a key dimension of independent living as well. Excitingly, the government have introduced a kind of continued programme for 100% broadband access by the end of 2021, which effectively means that superfast broadband would be accessible for every home and every organisation by the end of 2021, which is really exciting. And the last aspect there is the strategy really calls out the kind of highlight of digital inclusion through COVID-19. So I think we've all seen, you know, various things on Twitter, Facebook, Instagram around not just what we're doing in terms of connecting Scotland, but also the third sector stuff that's happening across the country as well, to get people linked in. I'm highlighting it only because we are obviously looking at a digital transition for grouped living and technology enabled care, but I suppose question where there's a link across to get people connected. Next slide, please. Thank you. I just want to touch on partnership working, and Geraldine mentioned this at the beginning. Obviously, I've only been in post for 4 weeks now, and what I've really observed is really strong partnership working happening across the whole technology-enabled care programme. So digital telecare, including the housing aspect, and Geraldine's programme, Tech and Housing, is all funded by the Digital Health and Social Care Directorate. So we all work under the same kind of organisation in some guise, and our kind of programme planning and progression of change is very aligned, which I think is great for the kind of digital telecare programme, because there's a lot of work happening centrally that we can really link into to help organisations across the country. Next slide, please. Thank you. I wanted to discuss risk, and I'm very aware of time, and I could talk in detail about the 8 risks that I've kind of planted out there on that slide, and there are more. But I suppose risks fall into 2 themes for this particular transition. There's risk to the tenant, and there's risk to your organisation. The risk to the tenant is that absolutely, if you have a telecare or group living setting in your home at the moment that's linked to an ARC or a hub, whatever you want to call it, the analog infrastructure and the deterioration in that, as well as the migration across various exchanges, will be having an impact. And we're already aware that failed calls have already started to increase, and that will continue to increase. The other aspect is the risk to your organisation. And the reason I'm calling that out is, I think, like I said at the beginning, this is a catalyst for yet another change. And I think we could really miss the opportunity to radically redesign what we're offering people on the back of this. To look in more detail at the risk, we've actually got a national briefing document, which is really helpful. It was co-produced last year by the Digital Office and a range of organisations, and that's available on the Digital Office website. So you'll see at the bottom of that orange logo there, if you go to telecare.digitaloffice.scot, you'll be able to, one, access the playbook that's previously been mentioned, but also access that briefing document as well, and that'll start to talk to those risks in a bit more detail. Next slide, please. Next slide, please. Thank you. While we're talking about the national briefing document, it really lays out 6 key things that organisations need to think about. And I just wanted to bring that into the slide deck to kind of start kind of talking that through. So the first one is around working collaboratively to coordinate the transition and have a robust comms plan in place. The second is around having a clear strategic focus on the transition. Third is taking full advantage of best practice and what's happening nationally. The fourth is around agreeing and following a roadmap to achieve a safe transition. Fifth is around adequate funding. And 6 is, what does the consumer expect? Okay, so moving on to benefits. First and foremost, we absolutely anticipate that the benefits of this technical transition and also the potential service transition as well will really enhance the citizen experience. We also know that increased resilience, greater flexibility and improved technology management will also be significant in this change. To give you an anecdotal example, I've previously been involved in a telecare business continuity event whereby Analogue alarms and the Analogue infrastructure had failed and had a direct impact on a cohort of about 1,500 people. And to overcome that, it required a lot of resource, a lot of additional resource, and it was also significantly risky in terms of people's lives. And it's not how we should work, especially now we're in 2021. So a digital transition would significantly shift that from, if you have 1,500 people who have a failed analog infrastructure, rather than having to go out and see every single person or speak to every single person to, let's say, reprogram a piece of equipment, actually digital tech would generally give you the option to do that remotely. More efficient delivery models, integration, prevention and consumer technology, these can all be leveraged if we look at the service redesign around this change. And I think if we do look at the service transition as a starting point, there are opportunities to look at how we kind of wrap the technology around what's currently being provided in terms of housing support and care. And the last thing I'm going to mention is efficiencies. And again, that comes back to improved technology management, greater flexibility. You generally have a lot more oversight and a lot more control over the technology in someone's house, as do they. And it makes the need for kind of repeat visits to someone's home for specific repairs or specific maintenance appointments null and void. Next slide, please. Thank you. Okay, so the next slide is really something I wanted to show people as a potential tool. So this is called PATH. It's abbreviation for Planning Alternative Tomorrows with Hope. So really this is a tool to allow organisations to really look at that wider service transition. So step one and step two is really about seeing, okay, we know that we have technology-enabled care and telecare in this situation. What is our dream? Because obviously this is just one aspect of the support that's in place. What is our dream overall in that picture? And then starting to sense the goal. So being more realistic and on the ground about your dream. And then starting to assess the now. It's step three. So a gap analysis of this is what our technical infrastructure looks like. This is what our service looks like. And then seeing actually what's possible. Step 4 and step 5 are interlinked. So who's on board? Who do we need to enroll? And how are we going to build strength? So who's on board is who are the key people we need to get involved in this change. And building strength is about finance. You know, where is the budget coming from? How are we going to procure it? What workforce changes need to take place? How can we support that? How do we engage with people? How do we engage with senior leaders within our organisation to buy into this change? And then step 6 and 7 is about taking that incremental approach to setting goals around what needs to happen. Next slide, please. Thanks. David's already covered what the offer is from the digital telecare programme generally. And I want to call out a few additional aspects that will be really key for the housing sector in Scotland. So service redesign is one, and I've already touched on that in the presentation. And the other is about thought leadership and collaboration across various housing organisations, because all organisations are faced with the same challenge. And I suppose the variation sits within every organisation has different priorities and has a different set of dreams around tech. But ultimately, it's about how we can kind of share that and use experiential knowledge to kind of build what we're doing nationally. Next slide, please. Thank you. So David's already mentioned that the digital office have created a range of playbooks and they've been in place for some time now. And he'd mentioned that a workforce pathway and a citizen pathway were due this year, and that's absolutely right. In addition to that, we want to look at a specific housing pathway. And I've put some thoughts there based on the survey that Geraldine done last year about key themes. You know, what do housing organisations need? I've tried to include that in there. But as the programme is at a very early stage, I think only until I start having more conversations with housing organisations and more people become early adopters in the space can we really understand what the pathway looks like. But I suppose the promise is from me is that there will be a pathway there that has underpinning guidance and resources as to how to kind of take on this change. And next slide, please. Thank you. So the last slide is just a bit of a plug around an upcoming meeting that's happening on Wednesday, the 21st of April. So this is our National Telecare Providers meeting, and that brings together providers from health and social care partnerships, councils and housing organisations as well. It would be a really insightful meeting if you did want to come along to it. And I know there's a specific breakout session in that meeting around reimagining telecare, which is one of the kind of central programs that's currently underway. In terms of kind of next steps, we're going to discuss that at the kind of close of this webinar. What I would like to say at this point is that I'm absolutely open and happy for housing organisations who have questions or want to start talking through how their organisation will take this on. I'm absolutely happy to be contacted, and my email will be available in the chat, and it's also on the next slide. So if you could bring the next slide up, please, that'd be great. Okay, and that's perfect. Thanks very much.
Thanks very much, Craig. And just so everybody knows, we will be sharing those details. We'll do a little post out after the event. So you should get something in a couple of days' time, and we'll make sure and have Craig's details in that as well. So Craig, David, I have to stop calling you Craig, David, Craig, would you like to put on your cameras again? Well, first of all, thanks very much. It's very disconcerting when there is that slight time lag on the teams like that.
Absolutely.
So I'm sure it gave you a couple of nervous moments, but two great presentations. Thank you very much for that. David, can I just come to you first? We have a question in the chat, and it's really about what housing providers should say to their customers. So there's something bigger. You know, analog to digital is bigger, it's telecare and it's more. So the question is there any marketing plan to make the public aware of analog to digital, and what can we tell our customers? Because this will affect their services, TV and radio, the move to digital. So, their services. And when we think about when we all had to get our new tellies, when TV and radio changed, then, you know, that was quite a lot of advertising around that. So where's the one about telephones? Do you know anything about that?
Yeah, no, it's a really good question, Geraldine. The short answer is there isn't one. I think, as Gregor mentions, we're all kind of familiar with a similar switch over to digital and TV and radio, and there were the kind of national campaigns that were to kind of make people aware of what they need to do and how to transition over. Unfortunately, despite even a bit of a pressure from organisations like Ofcom, the UK government have not gone down that route with this switchover. We would have liked to have seen it. I think it would have been important. I think potentially there was a wee bit of an expectation at the start of this transition that the end user might not be too aware of a change, which I don't think is the case. So I think from a kind of programme perspective, I think I mentioned the citizen pathway. I think Craig maybe touched on it as well, but from a programme perspective, we've been working away with some service providers to develop a range of materials which will be included in our citizen pathway, which we'll launch in the playbook in a month or so. And that includes a whole range of materials around how you keep your users up to date on what to expect, what the change means for them, potentially what improvements it could bring, but also some of the kind of risks around the transition. And it includes things like some videos, which might be kind of useful resource for people to watch rather than kind of heavy documents. It includes things like leaflets that you can share with your users, but we've kept some of these resources kind of unbranded, so providers can put their own kind of badges on some of these things to share with their customers or their users and their families. And that's the starting point for us. So as I mentioned earlier, just really keen to kind of build further content, to kind of call out to anyone on the call if they'd like to link in with us and help us kind of build some of those resources. We'd be delighted to have that conversation. But we're certainly building a kind of portfolio at the moment of kind of tools and resources that we will use to make citizens aware of the change. We've done a wider bit of work around kind of stakeholder engagement. So there's a range of resources that are aimed at people like chief execs, chief officers, to try and help get a bit of kind of senior level sponsorship. And Craig mentioned the national briefing document that also has quite a bit of information in there around the risks to the transition for users and their families. So hopefully what we've done at programme level is build up quite a resource, but it would have been nice to have seen something from a kind of top-down UK government approach as well. I think you're on mute, Geraldine.
Sorry, and hopefully with our relationships with Openreach and that, we can keep some of the pressure up. And I suppose another thing will be that the kind of communications that might go out in general to telecare users who use the dispersed alarms might be slightly different to those using group systems. But then we do know, and I know from many of you in the tech community, that we do have dispersed units in group living situations because the peripherals aren't linked into the group living. So, you know, we'll need to be very careful about how we approach that, so we don't scaremonger for those who won't be affected, but yet also make sure that we get that net covered wide. A couple of other things just to pick up on, and then we'll move on. Do you expect, David, that every housing provider will require to carry out a DPIA, data privacy impact assessment? Sorry.
Yeah, I mean, I think that would come down to individual organisation. I think it's a good, useful process to go through, because it gives you that kind of assurance and governance around your transition. You know, having said that, it might be for some kind of really small providers that they would see some of these milestones as being not necessarily essential for their transition. So, I mean, we'd be happy to do what we could with any provider. And it's a good point, Geraldine. I should have made this point during my presentation, but we don't see the pathways within the playbook as compulsory or linear. You don't have to move through each step kind of step by step. There are, you know, each organisation will take a view on different approaches, but we'd be keen to support if an organisation didn't feel a particular step was necessary, have a chat about how that might work and what the risks might be.
Thanks very much. And then there's just one more. Now, Craig, I know you've been saying, here's my contact details, get in touch. But you're the digital office for local authorities. Now, loads of people on this call are RSLs, registered social landlords. Can we just be clear here? Who all are you providing support to?
In terms of my role in the housing transition, it is very much about the digital transition for people who provide housing. So that's registered social landlords, whether that be a housing association, a local council, or a private organisation as well.
Brilliant. Thanks, Craig. Okay, so if you're okay, guys, to turn off the videos and the mics again, might come back to you later if there's any more questions. But now I'm really delighted that we're going to have the first of our housing providers to speak. So Dan, could I invite you to turn on your camera and your mic? Now, I know according to our strict programme, we're running over a little bit, but we're not, because I've actually built in a wee bit of bumps. So I know that we're all really looking forward to your presentation, so no rush, okay?
Okay, thank you, Geraldine. Good afternoon, everyone. Firstly, I want to thank you, Geraldine, and the SFHA, and indeed Craig and the Digital Office for inviting me to talk to you all about BHA's journey to redesigning services for our independent living customers. Before I begin, I just want to say that I've learned an awful lot just from the initial presentations this afternoon. So I've been jotting down quite rigorously details that I'll need to come back to. So I will be speaking to David on the digital telecare playbook, and certainly Craig, I'm interested in the Scottish Infill programme for the Notspots. So you can expect me to be contacting you afterwards. So to begin with, it's fair to reflect that BHA, like many of our peers, are very much in a period of transformational change across the entire business. We aim to develop more co-created solutions that place greater emphasis on customers featuring at the heart of our service redesign. It's a real privilege to join the speakers today to talk in more detail to one particular aspect of that change, and that's our independent living model. Molly, could you just flick forward on the slides? Thank you. So my first slide takes a quick run through the drivers for change. Like many local authorities, Scottish Borders Council were engaging in a review of support and people budget when I arrived in April 2019. And they were doing that alongside an overall strategic plan for older persons' housing, support and care needs. Now, initially, this formed the primary driver to change for our existing service model. But it was also apparent that whilst this would be the first, it would certainly not be the only driver to BHA redefining our services and ultimately improving, modernising and future-proofing our offer. Our shift over the last 3 years to a community-based approach to wellbeing, utilising our community initiatives team, but coupled with the use of technology, has been essential to reversing current trends and enabling more people to live fulfilling, independent lives in their own homes and communities. Of course, demographic changes remain a focal point for us all. And we know nationally that by 2039, estimates say that Scotland's population of over 75s will have increased by 85%. In addition, within Scottish Borders, it's estimated that people over the age of 65 shall increase by 40% by 2028. Couple that with the challenges around accessing connectivity, whereby 13% of people in Scottish Borders are denied access to decent broadband, compared to 4% average across the rest of Scotland. And obviously that's in reference to the universal service obligations. The digital switchover is therefore a green light and a key driver to developing and installing modern infrastructure across all our developments. BHA are engaged and excited by the prospects that lay ahead. Molly, can you flick forward again? Thank you. The initial timelines for implementing our withdrawal from support and people framework were very tight and ultimately didn't lend very well to developing meaningful engagement on the necessary changes. As such, we worked with our local authority colleagues to extend the lead-in time transitioning from sheltered housing, deregistering from the care inspectorate to the independent living model that we now have. One thing we did quickly recognise was that our customers didn't have a great deal of faith or confidence in consultation processes. Customers appeared apprehensive about any engagement. Previous shifts around commissioning budget allocation had led them to believe that any engagement would bring about a change of a negative kind, preordained, cost-saving and efficiency-focused, to the detriment of service with little feedback reflected in the new models deployed. We therefore knew that we had to engage in a different way, and from the outset took a very front-focusing role within the engagement with our customers. Obviously doing that in partnership with our local authority colleagues, but really owning the opportunities rather than referring to the withdrawal of commissioning funds. We did that with no predetermined agenda or even a model objective that was defined. Sure, there were going to be some parameters, but we were going to be open, honest and transparent as to how they were set, how we presented and positioned them from the outset. After hosting 6 initial listening workshops in July and September 2019, it was clear that any change was going to require a deep understanding of what our customers' needs were. We undertook a month-long consultation process in October 2019 and were pleased with a 91.5 response rate from all the customers we served. The feedback initially reflected some high-level observations that our customers broadly wanted more of the same, but were receptive to ideas of more modern digital products that would complement the existing service provision. 87% of our customers valued on-site staffing. 71% valued weekend contact. 84% sought to improve additional security and safety measures. And 68% of our customers reflected that the existing service provision at that time represented good value for money. So having dissected the feedback and worked on developing options for customers to review at our evaluation feedback sessions, the 4 models were presented and well received and reflected a move towards introducing more tech-enabled care systems alongside retained staffing and greater community partnership working to bring activities to our customers' homes. Upon reviewing the models and the breakdown of each service, the costs associated, the delivery approaches, the perceived outcomes, customers arrived at a 5th option, a hybrid of the 4 originally proposed models, which I think reflected our versatility and agility as we entered into the engagement conversation and process. Could you move forward again, Molly, please? So before arriving at our proposed models, we talked through other providers' models and introduced staff and customers to the likes of Blackwood's Clever Cogs. We talked through Wheatley Group's Living Well model and referred to other known revered models across the housing sector. We signed up to the Tech and Housing Charter, which provides us with a network to share ideas, discuss challenges, and gain knowledge from industry experts. Our co-created hybrid solution, this fifth option that I refer to, offered a blend of housing staff on site, which incorporated local partners to bring activities and socialisation. We utilised BHA's award-nominated befriending service. We launched our Let's Get Digital Berwickshire community lending library with 6 local third sector partners, offering 50 digital devices, SIM-enabled digital devices to our customers. One of the most radical changes we introduced was in partnership with Alertical's Housing Proactive OKHD product. This enabled our staff to be more visible and released time to focus on more complex housing-related issues. The advantages and benefits are well documented, as I see Alertical having a greater presence in Scotland, and we see lots of future service development potential within our now established relationship with Alertical. Upon reflection, we surveyed our customers quite quickly because we implemented this in December 2020, just before the secondary lockdown, which was thankful in terms of our well-timed in terms of deploying that product to our customers. We surveyed those customers in February just as a quick sense check as to how that had been implemented and deployed, and 95% of our customers stated that they felt safer having had the new product installed. An additional 95% citing satisfaction with the installation process throughout an environment in COVID-19. 95% citing satisfaction with the ease of use, a very user-intuitive system, and that was one of the drivers and real USPs for us as we went to try and buy it. 92% citing satisfaction with the customer service received, which is really, really a biggie for us. We had prior reference and understanding of how Alertical operated, and we had every confidence that our customers would get a really similar high quality service to that of which BHA hold a high regard for, and certainly reputationally want to protect. So with COVID-19 restrictions imposed on non-essential works, new security systems installed previously are primed and ready to be linked. And I've had a look at the delegate list today, so I can be thankful to a couple of my colleagues who are no longer with BHA, they've moved on and progressed to other opportunities, but you know who you are, guys. And it was much to do with their work that in terms of setting the foundations of our systems, albeit still largely analog, with huge headroom and headspace for then taking the next step onto trialing cloud-based digital platforms. So we are presently trialing a cloud-based digital platform using SmartLink gateways through our ACO fire detection systems. A new digital communicator will link our TimeTech door entry and our alarms to Hanover 24/7. And new CCTV will be installed in the near future, again linked to existing tech and infrastructure. Simultaneously and alongside that, we will be upgrading our Wi-Fi provision, albeit we do have Wi-Fi provision across our existing services. It's only within the communal spaces. We obviously want to expand that across all our residences and all our customers' homes. So that will be part of the next process. And as I said, if it wasn't for COVID restrictions around non-essential works, we'll be very confident that we might be a bit further down the road on that. Another vital commitment that was made with regards to our service was that it would be no more expensive than the service had previously been for self-funding customers, for instance, through supporting people. It would be HB eligible, and that we would fulfil our commitments on digital systems and enhancements. Finally, we've rebranded the service and diversified the eligibility criteria, and there'll be a short video at the end of this presentation to reflect that. Molly, could you move forward? Thanks. So we remain engaged with our RSL peers and SBC, that's Scottish Borders Council, on the integrated strategic plan for older persons' housing, support and care needs, as well as the local housing strategy, ensuring our role and contributions are reflected in both. We welcome clear and specific reference to homes that meet people's needs within the recently published Housing to 2040 National Housing Strategy, and again will reflect upon the opportunities that may emerge from that. BHA will embark upon a detailed customer insights programme through April and June this year, which will better inform our understanding of broader needs across our ageing population within our communities and influence and shape our service model for years to come. And our model will look to evolve, supporting more customers across communities to live healthy, happy and independent lives within their homes and communities for longer. Our staff teams will have access to digital platforms that provide real-time connections and assistive technology required to enable the expansion of this model. Molly, final slide for me, please. So there were some external forces driving initial change. We'd be remiss, of course, not to reflect upon the impact last year has had on accelerating our focus on implementing change. However, we believe at BHA it's our own ambition that has brought us to this point. Customers joined us on this journey to service redesign and will remain involved as we continually seek to develop a better customer experience. The switchover is a sector-wide green light, and we're excited for the future and all the potential it brings for independent living. BHA have the infrastructure, the setting, and now the digital services and model to support our customers to thrive and love the life they live. Now, if you can indulge me, I'd just like to play you a very quick video. This is a promotional video, so not necessarily, you guys are not necessarily our target audience here, but it's a promotional video that we've pulled together within the last month. Obviously, hurdling all the challenges that COVID has presented, it's still being finished with some more contributions to still come, especially from our colleagues in Alertical. But I felt it too good an opportunity today to not give you a sneak peek before its official launch in April. I hope you enjoy, and thank you for listening.
Welcome to Berwickshire Housing Association Independent Living, where we offer a lifestyle choice in an ambient setting for people to live independently, healthy and happy at home for longer. Designed exclusively for the over 55s, you are assured of a warm welcome with like-minded neighbours who will quickly become good friends. Choose from our studio or one-bedroom apartments, all of which are finished to a high standard. With assistive technology to allow you to maximise your independence. Our dedicated staff are on site from Monday through to Friday to help support you and provide that extra reassurance should you require it. Living as part of the local community of Berwickshire is what makes our independent living courts special. Our courts are located in Duns, Coldstream and Eyemouth, all of which have a wealth of activities and strong links to local services. You will become part of a wonderful community where the opportunities for new friendships, fun and enjoyment are endless. Located just a short distance away from the stunning historical harbour in Eyemouth, Lincoln Court provides the perfect coastal setting. Fishing at Eyemouth dates back to the 13th century and the harbour is still active with its colourful boats which can be seen every day. Austin Court benefits from 31 accessible homes, consisting of 20 single and 11 double occupancy properties. You may enjoy sitting in the lounge, which is inviting, sociable, and there's always lots going on. You can meet with your friends and neighbours for a coffee, or even try new hobbies, or just enjoy the views and relax. The Hersal is a wonderful place to walk, the former home of Sir Alec Douglas Home. The town benefits from a variety of local stores and services and a great community spirit, with over 60 voluntary, recreational and social groups, and you will always receive a warm welcome. Gowan Lee benefits from 32 warm, peaceful and accessible homes, consisting of 12 single and 20 double occupancy properties.
Just a laugh. It gives me peace of mind living here. The staff are very friendly.
You're your own boss. They're always looking after you. They're always making sure that you're all right.
Oh, Dan, that was excellent. Oh, my camera's just dropped. That was really excellent, and you're doing such a huge amount of work down there. So, and I love it. Love the life you live. Great rebranding as well. Tell me this, were you surprised by your customers' willingness to engage with you and with the council's willingness to engage with you around this?
I have to be honest and say that my predecessor did a lot of the work in terms of the initial conversations with the local authorities. So we had an established relationship which I was able to inherit, and that benefited me a great deal. I think what we basically said, I mean, you know how these conversations go. They can be quite, there's negotiation to be had and there's compromise to be found. It was at points it was quite frank around, we need to measure the impact. These are our customers, and at that point I said, we can do this a number of ways, and we ultimately arrived at the fact that we want to make this a positive message and sell the opportunity, because I did very much see it as that. I have seen it in previous occasions not done in that respect, and I think ultimately the only person that are the people that are affecting most of the customers. So in terms of our engagement, we did it collectively, but I was very clear from the outset that I wanted to be the lead on this in terms of our engagement, given that it was our customers affected. And maybe not in every engagement that we had, but certainly in this one, I was front of house, in terms of our consultations with our staff teams, but making sure that our residents, their carers, their next of kin, their appointees could all be present. They were all invited. At some points I had about 40 or 50 people squeezed in a communal area and communal room while we were talking about this, and it was very much a two-way dialogue. If I'm being perfectly frank, I don't think I would have got away with it any other way. So, we went through that. It was very much a case of building trust from the outset, building that trust. I was a new face to the organisation. Probably a younger head as well, where the enthusiasm around change, so there's a bit of stuff around that. But collectively as an organisation, we've got a fantastic staff team, and the customers certainly had confidence and trust in them. So I leaned heavily on that when we were in our engagement and consultation periods. But no, a fantastic relationship with the local authority. I think that we also understood the bigger strategic piece around it. That in Scottish Borders, they are rolling out some fantastic new developments. Trust are doing one right in close proximity to one of our independent living services around extra care housing. So we kind of felt like we'd been migrating and moving towards this different model, which was more focused around independence and less focused around care. And we felt that we could that was the right time to do that and make sure that we had complementing approaches, referral arrangements, and communications with other providers in the area.
Brilliant. Well, listen, really, really fantastic, really fascinating. 95% coming in from your customer satisfaction, and that's in no short measure because of the leadership and the customer engagement that's being involved. Now, what I'll do is I'm going to have to move on because we're rushing through time. But Dan, thank you so much. That was a really great presentation, and thanks for sharing your experiences with us.
No, thank you, Geraldine. Thanks, Craig, and Molly and Karen, because I know that they're busy in the background working away. So thank you.
They sure are. So what I'm going to do is hand over now to Sharon. So Sharon Hannah, like I said, she's with us here from East Renfrewshire Council, and she's Business Readiness Manager, and she's going to talk to us predominantly here now about working in partnership. So I'll hand on over to you, Sharon.
Thanks very much. Hi, thanks for inviting me to speak today. My name's Sharon Hannah, and I work for East Renfrewshire Council's Analogue to Digital project team. Housing. If we were to engage with housing across Scotland and complete an asset list of ward and call, I bet there would be an abundance of legacy kit out there just dying to be upgraded. Craig spoke of a national picture earlier, which I think is a really good idea to try and grasp that information. In East Renfrewshire, we now know what we have and what it's capable of. It works, but most systems are maintenance hungry. They don't support 869 megahertz, and they're absolutely is no flexibility by the way of data gathering. Flats have dispersed alarms layered on top, and that's to support basic telecare needs such as hearing impairment. Nationally, up to 33% have dual systems in place. No wonder we're reforming housing. The sentiment this time around is about reforming and redesigning with the future tenant in mind. I think you heard Dan speaking about that too earlier. The warden call system is an asset that supports the tenant, but also supports the fire, the door entry, the lift, the communal areas, and all this monitoring passes through the site, on site to the warden, and then off site to the alarm receiving centre, which probably from now on I'll call the ARC. Recent data analysis of our 8 developments has highlighted that 65% of out-of-hour calls to the ARC are door entry calls, proving concierge services are in high demand when the warden's off duty. So all in scope for improving safety, security, support, choice, accessibility, but one size doesn't fit all. So let's not apply what we have, but ask what's needed. A good way to start is by reviewing what additional support is provided. Assessing well-being calls can reduce managers' output by about 30 to 40%. Is a call needed if a carer is going in to attend daily? Or is a call even wanted? Have we asked? Engage, get to know what tenants want or in fact need, and it starts just with conversation. I don't think there's ever been a better time to assess needs. After a year indoors, most lives have changed, and some quite dramatically. A digital survey is a great way to gauge future potential for your tenants. Knowing what tenants have by way of digital devices within the home, but importantly, observing how and what they use those devices for. My mother's 92, she's got an iPad, an iPhone, an Amazon Echo. Sounds really promising. What she can't do is send or receive a text message, take a picture, get her head around WhatsApp, or even access the internet. However, the huge reward is her interaction with her family via FaceTime. But one small blip, and it exposes the limitations that require a home visit from one of our daughters to fix that. So a deep dive into digital accessibility can open up possibilities for some, but totally close them off for others, and we have to be really aware of that. With home isolation, it's never been more important to digitally connect, but does that come from a warden call system? I don't know if it does. Know what's out there by way of offerings from suppliers. There's a lot with bells and whistles, as telecare has grown exponentially over the past few years, and digital is kind of running behind, trying to catch up with the innovation that's out there. Combine the art of the possible with tenant-centred data and needs to define the housing system requirements. Molly, could I have the next slide, please? So, leadership. Know the service, know the tenants, increase digital knowledge, build confidence. Dan spoke of that earlier as well within the housing sector. Events like this are so worthwhile and a way of sharing and collaborating. Gather case studies, review achievements, and find out how digital is being embraced across the sector. Use the existing networking to engage and to understand the specifics, or start new ones. From within, make sure the right stakeholders are around the table. A multi-departmental approach, with perhaps IT taking the lead as to what you choose should be in line with other digital plans within your organisation. Molly, could I have the next slide again, please? So working together and gathering up the experts, that collaboration from within. In East Renfrewshire Council, it started with a strategic housing workshop, gathering up the experts, taking stock of where we are, where we want to go, with an end game of digital, but at this stage, without a product of choice. So moving on to reporting and data gathering workshop, what's lacking? What would help us do our job better? That's what those workshops are looking at. A snapshot of desired outcomes is on the slide, and they were both from the strategic and the manager workshops that we ran. So people unleashed from their silos, getting involved, and those who cross the customer's path especially, get those involved. Earlier I spoke of stakeholders and involving the right people, and we had participation from a whole host of IT specialists. Senior infrastructure officer, business relationship manager, he led all the workshops, information governance, information systems and digital risk officer, fantastic. Within housing and facilities management, we had tenancy services, improvement managers, property, capital and asset management, allocations, housing management, the sheltered wardens, the tenant customer engagement officer, a whole host of people. It was amazing, all experts in their chosen field, and the foundation of the workshops and the focus groups that we're running. The project team attended, and that was just to ensure the previously scoped out HSCP requirements and the alarm receiving centre system requirements played a valuable part within those workshops. If you think about it, in an average week, 133 hours of the 160 hours in a week, tenants and their housing support are moved over to the alarm receiving centre. So it's important to remember that. Lots of conversations. Next slide, please, Molly. Lots of conversations and data gathering, but most importantly, lots of listening. So the experts, I think the scheme wardens workshop, they're the experts at reviewing the fundamentals of service delivery. A snapshot of information's gathered there on this slide. It was so insightful when we spoke to them. Just a real reality check in how much they understand their tenants. Higher levels of cognitive impairment was noticed of those living with dementia and sheltered housing as well was observed. Some with difficulties like releasing the door to visitors or support. And because some of our warden call systems have got 3 buttons, you know, speech, release and do not disturb. Coping with that can be really hard if you're cognitively impaired. So coping with a new tablet controlled equipment might not be an option for some of our tenants, and we have to take notice of that. Wardens explain social activities were a big part of everyday life. Who would have imagined that bingo in a sheltered housing would be breaking the law? So after a year of isolation, missed are the face-to-face activities and social gatherings, talking whilst in the same room or without the need of a mask, and tactile experiences like a hug, shaking a hand, or patting a hand in reassurance. All taken for granted, but much longed for. Next slide, please, Molly. Interaction on a daily basis. That's what many people seem to have missed. So, opportunities and readiness. Establish what is known about the existing analogue telecare within housing. What's strong and what's wrong? What works well and what actually doesn't? Could I have the next slide, please, Molly? Protect previous investments and, if possible, utilise existing hardware. In the workshop, question each cohort, find out what barriers they face in their day-to-day job. It is absolutely amazing what you find out. Processes, paperwork, reporting, testing, building management, evidence gathering, KPIs, data requirements. There's a whole hoard of information that they have to deal with every day. The co-production ethos is currently embedded in telecare. My advice for digital readiness is to evaluate the now whilst reviewing service design ideas and scoping out the future opportunities digital can bring. In smart living solutions, dependents, peripherals, tablets, interactive between flats, video door entry, the ability for two-way audio and Bluetooth devices is all available. One note of caution, check for any kit that needs charging. It's a massive undertaking for tenants and those who support them. There is no doubt GPS devices, watches, pendants can save lives out there. But if they run out of charge, they're rendered useless. Next slide, please, Molly. So, engage to modernise. In conclusion, I'll recap the obvious and throw in some questions I still have, because we're not at the end of this, not by a long way. Timescales are really tight to deliver a large-scale programme of change. Supplier engagement is high, so harness that knowledge. Talk to other RSLs and councils in a similar predicament, or better still, those who are a little further along in their analog to digital journey. Scope out what needs to be done, and that's what needs to be done now, and what can wait till later. It doesn't all have to be done at one time. Engage with your workforce, talk to people, review the as is and the to be of processes. Process Modeler is a good analytical tool to use to quantify benefits and put that pounds into pence sticker on things. Questions like different housing service types, what can scale up quickly? Does amenity housing require telecare? Or what type of telecare does it require? Some favour dispersed units over ward and call systems. Cost this method would be my alert, and cost it correctly by way of ongoing charges and replacements. Financial longevity of ward and call systems normally far exceeds that of dispersed units, not to mention how do you monitor the door, the fire alarm, the lift, if there's no ward and call system. Could we be more commercial in our approach? Nice to have or a pick and mix basis? What about self-funding? Needs or want-led, policy or process, legislation or mandatory? Lots of questions, but without those questions, there is no learning. So digital allows remote and multiple access to ward and calls systems, permitting centralised admin and access without lessening the service levels. What can be done to remodel those activities? With digital, more data is available. Use it for the benefit of the tenants and to enhance the lives that they actually lead. Don't choose innovation over personalisation. And before introducing those bells and whistles, truly appreciate the benefits of bog standard digital. Then layer the innovation on top and learn from that as you go along. A balanced approach about what can be done now and what can wait till later. Having gathered as much information as possible from within, look for clear examples, publications. Local Government Digital Office has quite a lot of case studies on there, and get help from the Digital Office if you need that. Proof of concept testing is taking place across Scotland. Pour over those results, and if you're dipping into digital yourself, do what Scotland does best. Share your jotters. Thank you very much.
Oh, Sharon, thank you so much. You covered so much there. Wow, that was really great. And especially thanks for all the wisdom that you've shared with us, because you know, I know that you have so much experience in this, and you've learned a lot of the lessons, probably some of them the hard way, and that's what, yeah, and that's what we want. We want to hear what the learnings are. And tell me this. So it was really interesting because we were talking about working in partnership, and you clearly see working in partnership, working with the people on the ground who are the wardens, working with the customers in equal measure. Internally, who all did you say you were working with within the actual council and stuff like that? And how do they feel about this approach that, you know?
I think working within the council, and I'm new to the council, so I was a complete newbie to all this. So asking people for help, you know, I didn't care. You know, they were daft lassie questions and I didn't mind answering them. But getting those people around the table, what we've learned from ICT has been, from our IT specialists that we have there, has been absolutely invaluable. They think of things that you just wouldn't even approach, you know, from a service background like I do. I just don't think like them, you know, and sometimes that thinking can go beyond what we can possibly give people, but it's great to actually ask all those questions. And I think that the good thing about what we've done is in the workshops and in the focus groups, it doesn't matter if you ask a silly question. You know, we've got a real trust built up there where people can talk. Probably my favourite, well, I shouldn't say that, should I? But probably my favourite one was with the wardens. I just thought they were so insightful. I thought they knew so much about their tenants. And even now, when we've been locked up for a year, it was amazing the information we got from there. Probably one of my biggest things I would tell people to do is look at the statistics you have. They're hard to get out of an analogue system, and I absolutely know that, but you'll get them from your alarm receiving centre. Look at the statistics, look at why and how your customers are using that service when the manager's not there, because the manager knows why they're using it when she's there, But what happens for the 133 hours where you've not got them, where you've not got them, where you're cuddling them, you know, you've not got them within your development? What happens when they go to the alarm receiving centre? So I would say to people to definitely look at that.
Thanks, Sharon. Oh, Claire, thanks for joining us. Oh, you've put it off. Good. Thanks very much. And just one other question, Sharon, because, you know, having been involved in various different roles, I'm very aware of things need to be done yesterday. Yes. And in terms of the additional time that it takes to do it comprehensively and the timescales for the transition, and working with IT, and their very important need for risk management and all that side of things. Do you need particular skills, or is there anything that you'd like to share just in terms of balancing those two bits around getting things done but doing them comprehensively at the same time?
I would maybe, it's maybe not something I want to share, but it's something I want to ask. You know, cybersecurity in digital is huge, huge. And it's something, you know, my past 18 to 20 years in telecare, it's something I haven't had to worry about, you know. So cybersecurity is massive, and we have to take IT's lead, but also we have to work with the digital office, and they're looking at an assessed suppliers list. They're looking at, you know, ways that they can do a fuller assessment. You still have to do an assessment yourself. I mean, you can't just take the local government digital offices, but they can help us by looking at those suppliers and making sure, because cybersecurity, you know, I don't have an Amazon Echo. You know, I don't have things like that because I think they're listening all the time. I mean, somebody can maybe put me right there, but I think they are. So I don't have anything like that. And obviously then putting telecare over something like that when you're dealing with such personal situations, I don't know if that's a good idea. But maybe it's just not a good idea right now. Maybe you turn yourself digital and then you layer up. These things are in their infancy right now. We've all watched suppliers trying to chase ahead and catch up with digital, you know, while we're all saying we need to go digital. They're still running up behind us trying to catch up. You know, get yourself over to digital, then layer all those bells and whistles on top once you're there. Keep our customers safe, that's the main thing. Keep them safe, keep them secure, and make sure that's cybersecurity, because that's probably one of the biggest things as we dip our toes into digital that we've got to watch out for. Hope that helps.
That's brilliant. Sharon, thank you so much. That was absolutely fantastic. Thanks so much for taking the time.
Yes.
Really appreciate that.
Bye now, folks. And thanks, Molly.
So, Stephen, I know you've waited a bit of time here, but hi. So Stephen is like I said, head of contact center, Stephen Rankin, head of contact center operations with Beeld Housing and Care. So I'll just pass straight over to you, Stephen, and let's go.
Okay. So afternoon, everybody. Yes, my name is Stephen Rankin, head of contact center operations. I've worked for Beeld since 2014 and have been in this post since late 2019, so it was a bit of a baptism of fire going into 2020 and all its challenges. For those of you who don't know the history of Beeld Housing and Care, they're a housing association that specialise in older people, and it's currently celebrating its 50th birthday party this year. We had a party, hence the mention of it. They've got a stock of over 4,500 rented property and manage a further 1,200 owner-occupied properties throughout 22 local authorities in Scotland. So the need for effective communication is paramount. Despite, and probably something that Dan had mentioned, we had traditionally sheltered accommodation. Bear with me a minute. We had, yes, so traditionally sheltered accommodation, and we moved away from that to retirement housing. But most of our developments are still in that model with group living, communal areas and areas for staffing as well. Almost all of the properties have ward and call systems connected to BR24, or Alarm Receiving Centre. And BR24 is a department of Build Housing and Care, which was started in 1988 as an out-of-hours service to Build's own tenant group. And latterly it was expanded and offered, the services of BR24 were offered out to other RSLs and local authorities. Now, including Build's portfolio of about 5,700 connected properties, they've also got in the region of 30,000 other people linked to the ARC in some fashion for one or more of our services. So why us? Why have we been invited along to talk about this? Well, the reason for that is that BR24 are digitally ready. They started their journey back in 2017, and that was undertaken by my predecessors. That was started by my predecessors, who I think are in this room, are in this forum as well. So pressure's on. We are receiving test and live digital alarm calls as we speak through now IP and escape protocols. And for that, that was recognised by the Digital Telecare, and we were awarded a silver accreditation for our implementation of our digital processes. We want to go for gold, and hopefully mid-year we'll be able to meet that criteria, and maybe even gold plus. So fingers crossed. So in terms of the equipment, yeah, we've got about 150 fully wired ward and call systems in our developments, monitoring, as Sharon mentioned there, fire alarms, lifts, and individual flatted alarms, and also operating the door entry system. They also have an on-off site facility for our development staff to be a point of contact when they're on site, and BR24 when they are not. They are over varying manufacturers and varying ages, and we also have 30 non-staff developments with individual personal alarm units, PAUs, or dispersed alarms, whatever you want to call them. Our owner services manage another 26 developments who have a selection of all the above equipment. It's very varied as well. In the alarm receiving centre, we've got a Jontech database with an AnswerLink call handling software, and that's all kind of linked through John. There's a link there with Legrand, who own TimeTech and Jontech. So I'll come on to that later. They've got a new state-of-the-art facility in Glasgow office, which they moved into in 2019 and only used it for a few months before they all had to go home. We were distributed laptops, new laptops with soft phones for each call handler, all at the same time as that move, which proved beneficial later on. We kept and we retained our office at Anniesland. So we moved from Anniesland, which was BR24's main office, but we retained that as our disaster recovery site, which has been emulated. The equipment that we have in Glasgow office has been emulated in Anniesland as well. We've got over 57 employees operating a 24-hour, 365-day rota. And part of the foundation for our journey to digital was that new SIP servers were installed back in 2018, we think it was. And that's maybe a key date to remember in all this. So what was our motivation? Why have we become one of these early adopters? Well, prior to the ARC upgrade in 2019, Build recognised that the industry was being a wee bit left behind. The message from the communication providers was very clear. The analogue switch off was going to be happening in 2025, and by all accounts, in some instances, it's going to be sooner than that. Some development, we'd noticed some developments in digital PAUs had taken place, but the problem that Build had out of that was 150 of their properties had a fully wired ward and call system. So we had to explore analog to digital technology and group living. And we entered into a bit of a partnership with Telecare again, with David's team, in order to start looking at how we could overcome that. And we had some success. developing and testing a converter box with a leading manufacturer. We also had a communication outage in 2019, which was not very comfortable for us. It was 56 hours long. Only certain areas of Scotland were affected, and not all of the west of Scotland, so pockets weren't affected as well. Never really got to the bottom of what that was, but it was a very uncomfortable time for us, and we also made the pact that we would shorten our reliance on an analogue infrastructure. And obviously supply and demand, with 14,000 alarm links to BR24, there's only 300 or so using digital signals at the moment. So there's obviously a concern there that we want to push on with. So decision making, well, that's not an easy journey, that's for sure. The decisions and some of the options that you're given on that journey are really, really difficult and numerous. So I'll just go through a couple of areas where we saw decisions that had to be made. So our warden call systems, there are numerous ones on the market, both analogue and digital, although it's questionable just how digital they are. For a straight swap, if you were to take out one warden call system and swap it for another, you would be looking at, with the same wiring infrastructure within the development, we reckon about £20 to £30 for £30,000 for a straight replacement. £50,000 if you go for a full whole system, maybe at new build, or if you have to replace the wiring. So you can see the problem there. We've got 150 of those. Swapping them out is an impact of £4.5 million straight away. We have some that are 10-year-old, and we have some that are maybe only 2-year-old, and they're all analogue, and we need to replace them or do something with them before the end of 2025 or 2024. So our development with the Scottish Digital Office resulted in a bit of a time buyer for us, and this is a retrofit warden call connector box, and all it is taking you back to the TV digital switch off or switch over. All this is a set-top box, really. It sits with existing analogue warden call systems, and when the signal leaves the property, it is converted into a digital signal. It's through an IP protocol, but I think there's some work getting done on that as well. And it also has an analogue backup. So if the digital route failed, it would switch to analogue, and that will be switching. We use analogue just now just because it's available to us, but we'll probably be switching that to a GSM backup. These need broadband, as it was mentioned by the OpenReach demonstration, and we think with broadband included, possibly £2,000 a property to get your existing analogue warden call system to operate digitally. We're using these in anger just now. These work, and they're working well. The dispersed units or personal alarm units. This is clearly where the industry see the market going. The amount of development that's done in these is significantly more advanced than the warden call units, and they can connect through a broadband, they can connect through GSM using SCAPE protocol. Some have analog backup, and some have GSM voice call backup as well. So it's all very we noticed when we were testing these and using these that it's a very stable way of doing it. There's no real resort back to any analog or GSM voice calls, so it's been really quite advantageous from that perspective. They come with a device management portal, so that's almost like a device. It's a bit of software that manages the information that you get from these units, and they do bring us real big advantages, and we see this as being a very big advantage for every sector. At the moment, our alarm receiving centre will get warned or alarmed that maybe there's a power outage or the batteries are going down or whatever, the device management portal will give you a gentle reminder I think about 5 days before, so you can see the advantage of that. Instead of having to send somebody out as a matter of an emergency, you've got the opportunity of maybe programming that throughout the week and doing it at your leisure is maybe a bit strong, but certainly not as hastily. The cost for these are approximately £250 plus an ongoing SIM charge. So you can see the advantages of these. There is obviously, as Sharon alluded to earlier, the lifestyle monitoring products, the home management devices. You know, we're classing that as digitisation, and as Sharon said, maybe just a bit early for all of this just yet. There is analog to digital, and there is digitisation, but this is very exciting, and there's no doubting that once you've got that analog to digital working, this digitisation is going to be massive for our service users and citizens. So what are we doing just now? Well, COVID has obviously brought many challenges. The Glasgow office allowed us to embed safe working within that, but we did see anxiety grow even with them being in that sort of safe, socially distanced environment. So we set our IT team off with a challenge, and we managed to get our 100% of our staff working from home through the Citrix and iGel connections and our SIP servers within 2 weeks of lockdown being announced. This was revolutionary. We did a lot of presentations on this, and TSA were very interested as to how we actually managed that. It was made easier, certainly, by the investment that we had made earlier with the laptops and the soft phones as well. So, yeah, the advantages we're seeing just now with the remote working gives us real headaches and decisions to make in the future. We're rolling out the installation of the XT connector boxes to over 90 of our developments, which, if all switched on and all work going according to plan in the middle of this year, it will give digital connectivity to over 3,000 of our tenants very quickly. So that programme of works of rolling these out is happening just now. We are replacing a number of end-of-life warden call systems. So that's the warden call systems that are maybe 10-year-old or starting to fail on us, and or we don't want them to fail on us. So unfortunately, the slightly disappointing thing about that is that we just have to take what's currently on the market. We can't wait any longer to replace these. And the findings of a test of change that we did with the Scottish Digital Office in partnership with Renfrewshire and Inverclyde local authorities has brought. Well, the findings of this have been published on a report through the Digital Office, and we think this is maybe, if you are just starting your analog to digital journey, this is something that would help you make strategic decisions. So there are more decisions that we still need to make. So it was our desire, because of the outage and everything else that went on, do we still proceed? We had a vision of having our 100% of our tenants contacting us through a digital connection by 2022. Do we still proceed with that? And I think the answer is going to be absolutely. We need to. The time is running out. We need to make sure that come 2025 we are still in contact with all our citizens and and service users. Do we replace our existing end-of-life warden call systems with systems currently on the market? We're being forced into that just now because we don't think that the research and development that for warden call systems has been as advanced as personal alarm units, but the personal alarm units don't have a full warden call solution yet, so they don't look at the on-off site for staff premises. They don't look at fire alarms, door entry systems, all as effectively as a warden call system, a fully wired warden call system does. Then do we swap out all our warden call systems with personal alarm units? And we're doing a lot of work, and we're doing a lot of head scratching around this because we do see the advantages of the personal alarm units. And then do we hold off until Amazon and Google devices offer a suitable alternative? No, I don't think so. I don't think we can. I don't think our demands on Amazon and Google will make them hurry up and make them want to be compatible, use our protocols and stuff like that in time for the 2025 or 2023 cut-offs. So I think there is excitement around these, but maybe just not just yet. That should be parked for just now. Going forward, I think we want to incorporate the advantages of remote working into the future of Build. The workforce are so much more agile that now that they don't have to get up. If they're covering shifts, they don't have to get up. They don't have to get dressed. They don't have to get showered. They don't have to drive to an office. We're finding that our workforce is a lot more readily available as and when we need them, and there's no doubting that we should embrace that going forward. Want to accelerate everyone's move to digital. We've a vested interest in that because we have, I think it's in the region of 35 external clients who utilise our service, none of which have made any change to digital yet. So we want to develop an arc. We want to make this easy for them. We want to develop an arc capable of receiving digital signals for any alarm manufacturer. And we've done a lot of work around that. So we know we're testing various at the moment, and more manufacturers are coming on board to test for us. We want to assist in existing and new clients to move away from analog. So, we've done this journey, so we can help out. We want to facilitate investment in alarm sending technology. So I think the concentration has to be on that rather than the arcs, for talking's sake. We hear of a lot of people who are now starting the journey of upgrading their alarm receiving centre. But bearing in mind, and what I mentioned to you before, we started in 2017 and we are still well in the midst of that journey. I just don't know if there's enough time. We've learned a lot and we can share that, but I don't know if there's enough time to actually do everything. To investigate and share advice on the advantages new device management portals can bring. So we're seeing this just now. We have dispersed units out there. We are using them with other clients as well. And again, if I refer you to the report of the test of change report that we did in conjunction with Inverclyde and Renfrewshire, it's a good model to follow. Implement cloud-based solutions. No idea what that is, but I'm told I need it. Promote other digital services. So we're doing outbound telecalls at the moment, just to maybe try and see if that would result in reducing number of reactionary calls and alarm calls coming to us. And then lifestyle monitoring, we're also trying that out as well. And then further investigation, development and testing of smart wearable healthcare technology. Again, stuff that's very exciting for the future, but maybe not just yet when you're just starting your analog to digital journey. And I'll just finish off. That's the date, everybody. We're in 2021 already. We're wheeling our way through that. We're probably going into 21, 22 budgets. So not a lot of time left. So thank you very much.
Oh, Stephen, thank you so much. That was really good. I'm getting a lot of feedback. Sorry, I hope others aren't. If anybody other than Stephen maybe can make sure that they're on mute, that would be great. So yeah, an awful lot of progress that's being made, and really reassuring to hear that what you're looking at is, as the alarm receiving centre part, being able to receive lots of different alarms in, because, and I believe that some of the other alarm receiving centres are as well, and are being supported by Scottish Government to do that, because there is that thing, isn't there, about the housing provider, and it comes back to working in partnership. It's not just internal partnerships and partnerships with customers. There is also that importance of working with their alarm receiving centre to make sure that things are compatible with them, would you say?
Yeah. Oh, 100%. And if I'm honest, I think some manufacturers have been a wee bit naughty in that regard, because I don't think commercially it's great for them, because they would rather give the full end-to-end product. But I don't think procurement law in Scotland will allow that to happen, you know, because not everybody's needing to buy both at the moment. So yeah, so when I approach a lot of the manufacturers, they seem quite keen on it. You know, it's another revenue stream for them. So yeah, so they are quite keen to develop relationships.
Brilliant. Stephen, a question came in. I don't know whether you're placed to answer it or not, David, and I thought that I'd maybe be able to pull in Craig and David, but we're running out of time. There's a couple of things I just need to cover off first. But I'm wondering if you have just a quick insight. We've got the LD1 regulations coming in. We've got the housing providers who are doing sheltered, who will have the smokes in all the different rooms. Have you been coming across this issue that William's been raising about in terms of others' provision, which I'm guessing will be the HSCPs, that they're looking at putting less smoke detectors in, and whether you have any thoughts around that and around the safety for the tenants, or am I asking you to?
No, I think it's a great question, because you know, there are differences between what a warden call, just what I mentioned earlier. I'll come on to what you're asking, but it's linked. There are differences between what the dispersed alarm units can do in terms of mapping heat detectors, smoke detectors and stuff like that through this device management portal, and big advantages to that. However, we were a bit concerned, and sorry to be a wee bit morbid in this, but you know, in some of the bed sits and some of the sort of open planned areas where you've got your main living area and your kitchen all in one room, you know, like a galley kitchen or whatever, you run the risk of, you know, a smoke detector and a heat detector in that room is maybe a wee bit of overkill. You know, and not to put a morbid point in it, but if you're relying on a heat detector in that room, it goes off at 60 odd degrees, so it's too late. You know, the smoke detectors maybe the better solution there. So yeah, unfortunately, that's not a particularly nice topic, but yeah, it's very, very, very important.
Yeah. Thanks, Stephen. Now, we've only got a couple of moments left, so you're off the hook now to turn off the video. Thank you so much, Stephen. That was a great presentation. Will have given people a really good insight. So, folks, let me just say what happens now. So what we're going to do is we're going to send out something after this, and in that we'll have a link to the Telecare Service Providers Forum that Craig mentioned on the 21st that we're doing with Digital Telecare, Tech and Housing's doing with Digital Telecare and the Telecare programme. We're going to be sharing Craig's details. We'll be sharing the link for the presentations that you'll have seen, and the recording and the presentations that will come onto our SFHA website. And of course, we'll share the link for the Tech Charter and for the Playbook. But I really want you to take a wee note in your diaries now of the 12th of May. What we're going to do is we're going to run a Meet the Suppliers event. So we've been hearing about opportunities for dispersed units, group units. We've been hearing from Dan about Alerticall. All these various different things are on the market, and we thought, wouldn't it be good to put these side by side, have a panel of experts to be able to ask the suppliers some questions, or at least let us know what their thoughts are on what they're thinking, so that when you are listening to what the suppliers are having to say, it will help to inform your decisions. Now, we don't think that this, you know, we are strongly recommending that you're doing customer engagement, that you're, you know, checking what your assets are, checking what age they are. You heard Stephen talking about the digital communicator that's available for some products and depending on the age. But I think what we really are saying is, once you start to see some of the stuff that's out there, it may help to just keep your eyes wide open, alert you to this more. And like I said, these sessions that we're putting on, they're for all of the housing sector, and they're for all of your colleagues. So if you feel that somebody from IT needs to come along with you next time, do. If you've got a project team already established, that's grand. In the same way we have some problems with Teams with our little delays and stuff, we also have the opportunity of having everybody included. So so that's the 12th of May, and thanks very much, Karen. Karen has put the link in here, and we'll also put it in the in the chat. So all I have to do now is say a huge thank you to all of our speakers who've taken so much time to give us all a really clear understanding of what's happening nationally, what's happening with various different organisations in different parts of the country, and also between RSLs and local authorities. I must thank Karen and Molly at our events team, who've really helped pull this all together. And thank you guys for coming along. This is one of the hugest things that's going to be affecting us all, and the telecare part is going to be so critical for your tenants and customers. So I really hope to see you on the 21st of April at the Telecare Service Providers, and definitely on the 12th of May at our next event. So thank you very much, and I hope you enjoy the rest of your afternoon.